Well, without further ado, we will jump into our presentations. Mr. Thomas Habitz, again, Urban Planning Specialist with Henry Ford Health Systems.
Good morning, everyone. Thank you very much for the opportunity. It's very exciting for Megan and me. And what we wanted to do this morning is talk a little bit about what's going on economic development-wise and neighborhood development-wise with Henry Ford Health System, some of the initiatives that we're leading. Leave a little bit of time for discussions or questions if that meets with the pleasure of the group. And essentially, what we'd like to do is describe the stake that Henry Ford Hospital and Health System are putting into the ground in the city of Detroit, and the leadership role that we're attempting to play around the economic revitalization of the city that is occurring around us, and that we want to play a larger role in. As we approach 2015, the health system is approaching its 100-year anniversary in the city. So when Henry Ford developed the property at the corner of what was Hamilton Street and West Grand Boulevard in 1915, he used an employed physicians model, which birthed the Henry Ford Medical Group, which if you follow the trends in healthcare and administration and where we're going, that's proven to be a pretty enduring model that's coming back to the fore and is being promoted, of course, by the policy and by the government. And we're in a strong position to be able to continue to provide care to the greater Detroit community. So some of the work that I'm going to talk about today actually goes back to about 5 to 7 years ago and coincides with the tenure of our CEO, Nancy Schlichting. And at that point in time, she said, how can we be one of the most significant drivers of economic development within the city of Detroit? And that was before the period when the DMC went for profit, before a lot of the other investments in healthcare and healthcare facilities were moving outside the city. So it's left Henry Ford Health System as the lone remaining nonprofit healthcare provider in the city of Detroit. And it also happened at a time where we're making a major investment in West Bloomfield. And we have a marvelous facility out there that our board was strongly behind, but also said at the same time, whatever we do in West Bloomfield or in our other suburban locations needs to be balanced by what we're doing at our flagship, Henry Ford Hospital. And our goal is to continue to create that as a world-class academic medical center. So we've put about $300 million into the main campus at the same time that West Bloomfield was occurring. And the program that I want to describe today actually calls for an additional $300 to $500 million of investment in the city of Detroit. And my role for the past several years is to help us figure out how we can use that investment, leverage it, and allow it to stimulate neighborhood growth around there in a challenged community. Go to the next slide. Yeah, it's good right there. So, a quick map of just kind of the context that we sit. So, at the same time, the board and our leadership was establishing a vision for continuing to grow our campus in several different ways. We kind of looked at the context around us and said, where we are doesn't look and feel like you've arrived at a world-class academic medical center. And frankly, with the amount of activity that the health system generates on a yearly basis in terms of our employment, in terms of our procurement, we're not doing enough to feel like we're embedded in the community that we're in. So next slide, please. To describe a bit of that geographical context, I think probably most folks in the room are familiar with kind of the crossroads that we sit. And so Henry Ford, at the same time that some of this work was going on, was becoming a much bigger stakeholder in Midtown Detroit. So we were an active force in helping to combine the new Center Council with the University Cultural Center Association to create Midtown Detroit, and to begin to work a lot more intentionally with our anchors, our sister anchor institutions, around how do we align our development strategies and amplify the work that we do together. At the same time, the context of Henry Ford in terms of the operation on the boulevard, in terms of the property that we own, is a much different context from Wayne State University or the DMC, for example. So where they sit, near the cultural center and the university district is different from the boulevard, and we really see ourselves kind of at that juncture, or those crossroads between where a lot of the investment over the past 10 years has been occurring in Midtown, and where the rest of the neighborhoods start, which have a much different context and face continued challenges around disinvestment, blight, and the like. Next slide. At the same time, the new center district is ripe with opportunity. So we kind of said to ourselves, if we have 8 to 10,000 Henry Ford Health System employees right in the new center district, we have 24,000 overall employees in the new center district. Why is it that at Henry Ford Health System main campus, under 5% of our employees actually live in any of these districts? So we began to work with a consulting group called U3 Ventures, who is leading similar work among anchor institutions in Pennsylvania, most notably University of Pennsylvania. And they kind of came to us, they helped to convene the anchors, and we began to have conversations with Wayne State and with the DMC at several different levels. So the CEO level was prominent there, but it was also the Chief Procurement Officer. It was the Head of Human Resources. It was the Real Estate and Planning and Development groups. And they said, what can we do to act together to help to utilize all the activity that we generate in this area and actually direct it toward our local community? So we launched the Live Midtown program, and that provides an employee housing incentive for any current employee of any of the 3 anchors. And that's been a phenomenally successful program. So we put in some money, it's matched by some grants, and it's been subscribed fully by August of every year over a 12-month allocation. We're also beginning to purchase a lot more local and hire a lot more locally. So of the 3 anchors, we do about $6 billion a year in operational procurement. And at Henry Ford, about $1.6 billion just on our own. Of that figure, we're actually procuring less than 5% among City of Detroit businesses. So we said to ourselves, what is it that we can do to increase that and figure out what the resulting economic impact is going to be when we do so. So we know if we could take that up to another 5%, we're going to actually provide about 1,000 more jobs every time we get to 5%. And then we started to look at what our peer anchor institutions and peer cities are doing. So if we look what they're doing in Philadelphia or Chicago or Cincinnati, cities that look like Detroit in a lot of ways, we can get to 25-30% of employees living in the area, and of all of the procurement that we do, 30% going to City of Detroit businesses, and especially to minority-owned businesses and women-owned businesses. And to date, we have transferred about $17 million of procurement to Detroit-owned businesses since that initiative started. But we have quite a bit more potential to do that. Next slide. So, in addition to the anchor work that we've been doing with our sister anchors, we also said to ourselves at Henry Ford, the neighborhood that we sit in has tremendous potential and also a lot of challenges. So we began to look at the area just south of West Grand Boulevard, between Wayne State and the main campus, so north of 94, south of West Grand, and west of the Lodge. And we began to do a little bit of planning around the way that particular area could develop in the future. So in 2008 and again in 2011, we worked with some consultants to develop a master plan with our local community stakeholders. Held a number of charrettes and separate planning exercises, went out to a number of community groups, as many as we could find, and Megan's going to talk a little bit about that in more depth in a minute. But we developed a master plan, and Henry Ford is not the City of Detroit, Henry Ford is not the local community organization, but we knew based on the fact that we have growth potential, we can do some facilities development, and we can actually work with developers and other folks to generate interest around an aligned plan for that neighborhood. We could start to see a lot more growth than just what the anchors are doing in general and developing some policy and some strategies, but we can actually do housing, we can bring in businesses, and we can help to revitalize the community in that way. So the 3 words that you see on the screen are the 3 principles by which we vet every project that we like to get involved with. And these were adapted through a large measure of community cooperation. So everything that we intend to do needs to integrate us to the surrounding neighborhoods, as well as within the neighborhood ourselves. So one of the biggest challenges that we're going to have, but also the biggest opportunities as we develop our facilities, is not to do them in isolation, not to do them inward looking, not to do them, frankly, in a campus style, but to develop densely in a mixed-use walkable fashion that's going to integrate us with everything that we do in the surrounding area and what is existing there in terms of residents, assets, buildings, and the built environment. placemaking to build places that are attractive to people. So today, where you go to your doctor's appointment or you go to work and you can't wait to leave, we want to build places and help to create an atmosphere that feels like the opposite, where you want to spend additional time, where you feel comfortable, where you feel like home, and you might consider making a home. And authenticity. So not only to respect the current built environment, the current populations who live there, but build on the assets, build on the character of the architecture, build on the built urban form that we have it, and really utilize that to our advantage. Some of the strongest feedback that we received in the process of doing a lot of the engagement around this was that we all like what we have. We want to see neighborhoods come back to what we remember when neighbors knew each other, and our homes were built like traditional main streets, and they were covered with a tree canopy, and a lot of the traditional neighborhood types of setups and values that we've lost that we think we can bring back, and that's the opportunity that we have. So a couple images on what the community process looked like. As much as there's not necessarily one community-based organization that represents the neighborhood, we've had the opportunity to engage with many of them. And we've had phenomenal turnout at a number of meetings. What's interesting about that is a lot of folks attended some of our first meetings and said, I've been waiting 10 years for this. I've lived in the neighborhood for a very long time, and it's about time that Henry Ford got involved in helping to work with us and make our communities better. A couple of images on what the future could look like across West Grand Boulevard with the fruition of some of these plans. And so this is an image if you were looking south from the main campus. Maybe you were halfway up that Clinic Tower and looking across the street. Notice right in the foreground what the boulevard looks like. So there's some stripes there and some different pavement. We really want to try to bridge the gap across the boulevard. So right now, as you walk across the street at West Grand, it doesn't feel great. There's really nothing to connect you to the other side. We need to shrink our streets. We need to improve the infrastructure and help to create an environment that is actually welcoming, accessible, and well integrated. So these aren't necessarily the buildings that would be built, but this gives you an indication as to the scale, the look and the feel, the connection, kind of architecturally and design-wise that we'd like to create with the historic 1915 building. And I think we achieved that with kind of these medium density, medium rise type of buildings, not towers that are going to shadow over people, but buildings with differentiated uses at the ground floor that can actually provide some retail amenities for not only visitors, employees, but also residents of the community. A similar image here of if you'd be looking maybe up Trumbull Avenue as you come up, which is currently a lot of vacant space. This is the opportunity that we have to develop that sister space just adjacent south of West Grand Boulevard to main campus. And then this would be going a little bit farther down Trumbull and looking up to the north. Again, a lot of development opportunity. Currently, I don't have a before shot, but if I had one, and you were looking north here on Trumbull, you'd have a vacant lot to the right-hand side, which is pretty severely contaminated, and a junkyard to the left-hand side, which has been a major nuisance in the community for a long period of time. We worked with the city, and major credit to them. They helped to get that operation shut down very recently, and it's going to be a big benefit to the neighbors and actually going to produce a pretty large developable parcel where we think housing would be a very good future use. So thank you very much, and I'm going to turn it over to Megan.